In Idlib, medical resources were already stretched thin before this natural disaster struck. Now, medics are having to respond to a dramatic influx of casualties and are drawing on help wherever they can get it. DW's team in Syria report.
At the Al-Shifa hospital in central Idlib, medical students are quickly finding out what it's like to be a doctor. They've been working non-stop since the earthquake struck several days ago. Currently, they're treating 200 patients described as in critical condition, more than they would normally be able to handle.
We have a large number of patients, and it exceeds our capacity. In spite of that, we are giving it all our effort. Patients have multiple injuries requiring more than one treatment. We need all the support we can get in our hospital, including surgical and medical supplies.
While they wait for reinforcements, they manage as best they can. And that requires harnessing all the resources available and improvising.
We've switched all the wards from cardiac care to surgical care. Most of the wards have been completely transformed. The entire staff has been called in for a full week because of the tremendous pressure on the hospital. And we also have a shortage of medicine in our stockpiles.
More help is on the way to this hospital close to the Turkish border. An advance team from a Spanish aid organization is paying the hospital a visit to lay the groundwork. It's hoped they'll soon have an emergency hospital up and running to help boost treatment capacity here.
To tell us more about this unfolding crisis, let's bring in Jennifer Higgins, Syria Policy Coordinator for the International Rescue Committee. She's joining me today from the Jordanian capital, Amman. Jennifer, thank you so much for taking the time to speak with us. Your organization is on the ground providing support in Syria. Many people there have already lost their homes many times over because of the ongoing conflict. Can you describe for us the situation that they are facing now?
Yeah, thank you very much for having me on to discuss this. I mean, this area of Syria, already before this disaster, was incredibly hard to access. The situation really remains dire. It's a region where 90% of the population were already reliant on humanitarian assistance. Hundreds of people reportedly remain trapped in the rubble of collapsed houses. You know, this earthquake came really at the worst imaginable time, where people were in bed asleep, and many of the houses just weren't built to sustain the impact that an earthquake of this size could have. You know, community-based responders are really fully occupied with search and rescue, and the huge number of casualties is just overwhelming hospitals and medical centres in the northwest. You know, the health system there was already critically fragile even before this, not only from the COVID-19 pandemic, but also up until, you know, the earthquake. We were working to respond to a very serious cholera outbreak. There was 30,000 cases just in December, so you can imagine that that's all still happening in the background of this big disaster. And we've already had around 30,000 displacement movements recorded in 3 days between the 6th and 8th of February. And this is a population that has had to move maybe already a dozen times over the last decade of conflict. You know, those who have survived are now facing another day, you know, exposed to the elements, freezing temperatures. We've had reports of flooding also, and they're just in desperate need for safe shelter, electricity, medical aid, and sources of heat.
Thank you so much for sharing with us how urgent the need is. But since the earthquake has struck on Monday morning, we've seen that international, in general, has been reaching Syria in particular slowly. At this point, 5 days later, how much aid is able to get in?
Yeah, it's been really, really hard to estimate this. And, you know, the one thing that we have to remember is that, you know, where the main crossing points are, they are, you know, between Turkey and northwest Syria. The main crossing point, which the UN uses, Bab al-Hawa, to move goods between Turkey, cross-border between Turkey and northwest Syria, is in Hatay. And this is one of the most affected regions, you know, in Turkey from the earthquake. So some of the delay in the first few days of getting aid across was simply because of infrastructure damage to roads, and also because the staff that are working in these crossings themselves are also impacted by this tragedy. But I think we do welcome, certainly, that we've seen some aid convoys go across from from the UN over the last 2 days, and we expect this to really ramp up urgently so that we can start to see the necessary assistance get to those communities who need it most.
And what exactly needs to happen in order to see more of those aid convoys getting across the border and getting to where that aid is needed?
Yeah, I mean, as I said, and as you've said now, scaling up of this assistance is really of paramount importance. You know, we need to be really seeing a lot more convoys going across. You know, everything should be needs-based and really focused on what local organizations are telling us on the ground. You know, what doctors are telling us, what local organizations are telling us that they need. You know, since 2020, the UN has only had one border crossing, you know, into northern Syria after the other, Bab al-Salam, was closed for UN operations. Many NGOs can still use these, you know, for commercial routes, but understanding access has been really difficult since then. You know, the increasing needs in the northwest really show that we just need to be prioritizing, you know, specific goods to be able to get in. And as you've already highlighted earlier before I came on, you know, the health system in particular is really critical, and we need to make sure that we're getting in the necessary medical goods to be able to support the huge response that's needed now.
Thank you so much for joining us today. That's Jennifer Higgins, Syria Policy Coordinator at the International Rescue Committee. Appreciate your time.
Thank you for having me.